There has been a growing health concern in Delaware over cancer clusters, those areas in the state where higher than average rates of cancer pop up. Most of them are in Newcastle County, but there is one downstate that has generated some concern. Zack Seward of the WHYY Health and Science Desk has been looking into that. Zack, you're the newest guy on the team, so we say welcome.
Hey, Nichelle. Delaware's Division of Public Health is trying out a new tool for investigating these clusters. It's a project that takes blood, urine, and hair samples from a few dozen people in Millsboro. It's the first time this has been tried, and while the state is hopeful the results can provide some answers, others aren't sure if that will work. Coal power causes cancer. In a nutshell, that's the concern of Bill Zack. He's the co-founder of Citizens for Clean Power.
We thought it was high time that the state look into this. So we petitioned the Department of Public Health to do just that.
The agency ultimately took up the cause and found that Zack's group was right. The incidence of lung cancer near Indian River Power Plant was higher than normal.
So there was an enormous difference between the national average and even an enormous difference between the lung cancer incidence local to around the plant and the cancer incidence in the entire county of Sussex.
But that doesn't mean the coal-fired power plant is the culprit. The 2008 study conducted by the health department could not rule out that tobacco was the driving force behind the cancer cluster, so now the agency is following up.
The biological sampling was really just to start taking a look and see what was showing up acutely in people's bodies. Again, just to refine our methods and our processes for doing a larger, what we might call a body burden study.
Lisa Henry is the public health administrator leading up the current study, and in many ways, Indian River is the epicenter of cancer cluster research across the state. Henry says body burden testing is a new tool that gives health officials a snapshot of the chemicals floating around a person's system. The state got samples from 32 volunteer participants last year and will soon begin round 2 with the same group.
So we may be able to make certain conclusions that help steer us in certain directions, but that's not the same as saying definitively what we're finding in their bodies was related to the power plant and that's causing cancer.
Paul Silverman is Associate Deputy Director of the Division of Public Health. His agency's initial findings in Millsboro led to the identification of 7 other cancer clusters across Delaware. If funding permits, Silverman would like to expand body burden testing statewide. Still, he says it's not the point of the study to draw a clear link between industrial pollutants and higher cancer rates.
A cluster is defined as just an unusual occurrence of a lot of cancer. So yes, we see that in Delaware. The real issue is, why are they occurring? Is there anything that we can practically do about it? And that's a much more difficult question to answer.
With things like exercise, aging, and smoking causing 3 out of every 5 cancer cases, Silverman says lifestyle factors are the low-hanging fruit that health officials should focus on.
The community, however, was still concerned about the excess risk that may be caused by the power plant.
No way is the smoking incidence the likely cause. The low-hanging fruit here is this plant.
Despite initial pushback, Zack says the Division of Public Health has become much more responsive to the issue of cancer clusters.
It had been decades while people really knew that there were smoking guns here and nothing was happening to study the issue. So we said, we don't have another 5 or 10 years to wait. Let's get on this and at least get this as a pilot project within the larger state air quality study.
Zack thinks the current study is taking the state in the right direction, but he says more needs to be done to rein in industrial emissions.
Kids are going to be living, breathing this air. It's too late for adults, but children shouldn't have this. When adults know that it's there should be action.
Health officials will present the findings of the Indian River study later this spring. I did speak to NRG Energy, the group that owns the power plant, and they wanted to stress that they've recently invested over $400 million in pollution controls. Some of those upgrades were done as the testing program began last year. Spokesperson for the plant said the company does support efforts to improve air quality in the state.
Well, Zach, tell me, what will happen with this study? Can it be a part of a bigger anti-cancer push in Delaware?
Well, state health officials that I talked to, admitted that higher cancer rates have been a problem for Delaware for decades. Now, they've had some recent success in lowering those numbers lately, and this is really part of that project. And the goal, again, is adding to the pool of knowledge about cancer research here in Delaware. And to be able to say, X caused Y isn't really the focus of this study. Right now, they just want to refine a methodology, not determine either way if this power plant has some direct relation to the higher cancer rates.
Thank you, Zack Seward of the WHYY Health and Science Desk. You can read more about Zack's story when you log on to the Health and Science in Delaware pages of newsworks.org.